Hi, my name is Stutter. I want to tell you about an article I came across the other day. This article I found on abcnews.com. It was posted by Meena, I hope I get this right, Venkataraman on July 31st, 2018. The title of this article was Medicare for All programs could cost $32 trillion but also save $2 trillion. $2 trillion is a lot. I don't know why we wouldn't want to save $2 trillion. Medicaid for all. This term has been being used quite a bit lately. It's a term that's synonymous with universal health care. Senator Bernie Sanders, he was a big advocate of this and has been since his 2006 run for candidacy. Needless to say, he was pretty happy when this new study came out. The title of this study was The Cost of National Single Buyer Healthcare System. It was written and done by Charles Bloss, who was economics advisor to George W. Bush and the public trustee of Social Security and Medicare from 2010 to 2015. On July 30th, the Mercatus Center of George Mason University released paper on 10-year fiscal impact of Medicare for all, and the transition period from employer-based to Medicare, which is about a 4-year period. In this paper, Bloss indicates a possible $2 trillion savings from the year 2022 to 2031. Needless to say, Senator Sanders, he immediately tweeted about this, thanking the Koch brothers for accidentally making the case for Medicaid for all. I'm going to show you a quick video of pretty much him pushing this.
Koch brothers, of all people, for sponsoring a study that shows that Medicare for all would save the American people $2 trillion over a 10-year period. I suspect that that is not what the Koch brothers intended to do, but that is what is in the study of the Mercatus Center, an organization that is significantly funded by the Koch brothers. At a time when the United States spends far more per capita on healthcare than any other country on earth, almost 18% of our GDP, a Medicare for all healthcare system would save the average family significant sums of money. It will do.
As you can see, he took the information from this study and pushed his own agenda. Now, did he take all the information? I don't know. $2 trillion. Seems like a no-brainer. Seems if it's true, then yeah, we should do it. We should be all in. Truth. $32 trillion over 10 years. That's how much it's going to cost to initiate this program and put it into effect. At least $32 trillion. And the other thing, according to the study, if all factors come out exactly as projected and as estimated, healthcare expenditures would drop from $59.4 trillion to $57.6 trillion in the 10-year period. This is where they get their $2 trillion figure from. This is what they base it on. But like I said, everything's got to come out exactly as projected and estimated, and I don't know if that's possible. Dr. Bloss, he's the one who wrote the study. He's the one that, and he wanted to come out and do some clarification on it afterwards, after Sanders came out and used it to push his agenda. So he wrote another article called Question and Answers about Medicaid for All Costs. Again, it's by Bloss. He posted this on 8/21/18. You can find it on economics21.org. One of the things he wanted to do in this question was point out some of the things that were in the article or in the study, the initial study, and some of the references from there. Here's 3 quotes that you can find in the study. In the very first paragraph, it's got one part that says these are conservative estimates. It's got one on page 4. These costs estimate a lower bound. And then in 2 different sections, including the very first paragraph, it's likely that the actual cost of Medicaid for all would be substantially greater than these estimates. He's indicating that he already knows these estimates are way low. The other thing, and the other thing that's not clear, and the other thing he couldn't really provide much data on, is how hospitals, physicians, and other healthcare providers would respond to the reduction in the reimbursement. Medicare reimburses at a much, much lower rate than your normal work healthcare that you get. It's actually about 40% less. So how are the hospitals, physicians, and everybody else going to react to getting much, much less per patient? There's no way to tell. So Sanders, he's pushing his agenda. He's cherry picking information from this study, just the stuff that works for him, not really using what else there is. Does healthcare need some changes? Sure. Reform is needed. Is this what we need to do? I don't know. But it's hard to trust him and what he's saying when he's cherry picking the information just to push his agenda. After fact checking and getting all the information from both sides, I think a lot needs to be addressed before we can go all in on Medicaid for all.